Okay, picture this. A chaotic emergency room. A patient is seizing, or maybe they're in the middle of a terrifying panic attack. In those critical moments, there's one drug that clinicians often reach for first, diazepam. It's powerful, it's fast, and today we're going to pull back the curtain and really dig into its clinical profile to see why it's such a go-to medication.
So here's the game plan. We're going to build a complete picture of diazepam in 5 steps. We'll start with the basics, what it is. Then we'll dive into how it actually works in the brain. From there, we'll cover when it's used, the risks you got to watch out for, and we'll wrap up with the really crucial details on dosing.
All right, let's kick things off with the fundamentals. So what exactly is diazepam? Well, it's part of a class of drugs called benzodiazepines, and its whole job is to work on the central nervous system. You can basically think of it as a dimmer switch for the brain, calming down all that excessive electrical activity. And that's what makes it so incredibly useful for a whole range of things, from stopping an active seizure to easing severe anxiety.
Okay, so that leads to a really important question. We know what it does, but how? How does it actually achieve these powerful calming effects? Let's take a look under the hood at its mechanism of action.
I absolutely love this analogy. This is probably the best way to wrap your head around how diazepam works. Think of it as a brake booster. See, your brain already has its own natural braking system to keep things from spinning out of control. Diazepam doesn't invent a new one, it just hops in and makes the one you've already got way, way more powerful.
And here's how that boosting actually happens, step by step. First, it hones in on these really specific, deep parts of the brain that handle things like emotion and arousal. Second, and this is the key, it potentiates. Now that's a fancy word, but all it really means is that it supercharges the brain's own natural calming chemicals. It helps them do their job better and for longer. And the result of all that? Step 3, the seizure threshold gets raised. Basically, it now takes way more electrical chaos to trigger a seizure. It effectively calms the storm.
So with that whole mechanism in mind, let's get practical. When are the specific times a clinician would actually reach for a dose of diazepam?
This slide really shows you just how versatile this drug is. I mean, the #1 use is for active seizures, for sure. But it's also a first-line treatment for severe anxiety or panic attacks, and it's essential for managing the really dangerous symptoms of alcohol withdrawal. And it doesn't stop there. It's also used to relax muscles and, this is a big one, to sedate patients before pretty uncomfortable procedures, like cardioversion, where they literally shock the heart back into a normal rhythm.
In an emergency, speed is everything, right? And this is where diazepam is an absolute rock star. When it's given through an IV, it starts working in just 2 to 5 minutes. I mean, that's fast. But here's the twist. Look at that duration, only 15 to 60 minutes. You might be thinking, wait, that's it? Well, it's not because the body gets rid of it that quickly. Instead, the drug rapidly redistributes itself. It moves from the brain into other tissues, like body fat. So its effect on the brain is incredibly powerful, but also very, very brief.
Of course, with great power comes great responsibility. Any drug this potent is going to have some pretty significant risks, and understanding these is every bit as important as knowing when to use it.
This slide breaks down the risks into 2 really important buckets. On the left, you have the contraindications. Think of this as the do not use list. These are hard stops. You would not give it to a patient with a head injury, for example, or someone who's already having trouble breathing. Then on the right, you have the adverse reactions. These are the things you have to be on high alert for. And notice, respiratory depression, slowed or stopped breathing, is so important it shows up on both lists. That, along with a big drop in blood pressure, are 2 of the biggest worries.
And this warning right here, it really drives the point home. Pushing diazepam too fast through an IV is just plain dangerous, and it's an even bigger risk in older patients. It can knock out their natural drive to breathe and cause some really deep sedation. That's why you'll always see it given slowly and very, very carefully.
You also have to be super careful about what else is in the patient's system. Diazepam will basically amplify the effects of any other depressant, like opioids or alcohol, and that can create a really dangerous cocktail. And, it's also kind of picky from a practical standpoint. It doesn't play well with most IV fluids. It can literally form solid crystals in the IV line if you're not careful. No joke. That's why it should only be given through an IV running with normal saline.
All right, let's bring it all home. We're going to get into the nitty-gritty of the specific numbers and some really important patient populations you have to think about when giving this drug.
This table lays it all out so clearly. Just look at the huge difference in dosing depending on who the patient is. An adult might get 5 or 10 milligrams, but an infant gets just a tiny fraction of that. We're talking tenths of a milligram.
pushed very slowly and carefully. And you can see there are very clear maximums for each group to keep things safe.
Beyond seizures, you can see the dose for something like cardioversion is a little bit different. But we absolutely have to pause and talk about this last point: pregnancy. This is a big one. Using diazepam in a pregnant patient is a serious balancing act. It comes with very real risks, like premature birth or breathing problems for the newborn. So in these situations, it's only used when it's absolutely necessary and always at the lowest possible dose that will get the job done.
So when you put it all together, diazepam is this incredible, often life-saving tool. It's like the firefighter that shows up and puts out the blaze in just a few minutes. But as we've seen, its effects can vanish almost as quickly, thanks to that rapid redistribution away from the brain. Which kind of leaves us with one final big question. Is diazepam's greatest strength, its amazing speed, also the source of its greatest clinical challenge?